Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into my latest video. The patient in this procedure attended with deep impacted earwax directly on their left eardrum. They'd been using a combination of cotton buds and also hoppy ear candles in an attempt to remove this wax, but all they managed to achieve was to just further impact the wax directly on their eardrum. Now you can see the patient's ear canal is quite bendy. This is the second bend, and as we go in and out of the ear, you will see how pronounced that second bend is. So when you enter the ear canal orientation goes towards 45 degrees to the right, and then it straightens at the second bend. So when you have a bendy ear, it can be sometimes a bit tricky because we're having to navigate the bends in the ear, and the instruments we use, and they're not flexible, they're rigid. So we use a rigid endoscope, and we also use a stainless steel suction probe, so they don't bend. However, fortunately for us, as audiologists and clinical ear care specialists, the outer third of the ear canal, so these bendy regions of the ear canal, are made up of cartilage, so they're malleable. So it's very easy, once you've developed the skill and technique, to straighten the outer part of the ear canal up to the second bend. Typically from the second bend, the ear canal is quite straight, and beyond the second bend of the ear canal is made of bone, which is rigid. It's not malleable, it's not flexible. So I started off using a Zollner suction probe, a standard Zollner suction probe, to remove the mass of this impacted wax directly off the eardrum. And you can see there's some residual sticky wax, dead keratin, some hairs. You can see those hairs are matted there. And therefore I've resorted to a fine end gauge. A fine end I use typically when we perform procedures more medially towards the eardrum, because the tip of the fine end, it's a lot more narrow, so it's less noisy for the patient. It's less traumatic if you do come in contact with the eardrum, God forbid, or the ear canal itself. You're less likely to cause severe trauma. And deep in the ear, we have a narrowing the isthmus, and so the ear canal naturally narrows, and therefore, because this is a narrow suction probe, it's more accessible. We've got more finesse, more precision in the work we do. Another reason also, with the fine end gauge, it's less noisy, less suction power. At the same time though, because it's got less suction power, you're less likely to develop the caloric effects. And when we suction very close to the eardrum, we reduce the core temperature of the ear, which then affects the balance organ. And that sometimes can lead to the caloric effect. And with a fine end, you're less likely for the patient to develop the caloric effect and feel dizzy and experience vertigo. So you can see I'm just very delicately, gently, just maneuvering this dead skin, the base of the ear canal, without making contact. Whenever we're in the inner 2/3 of the ear canal, when we train our earwax delegates, I always make reference to that game Operation. We don't want to touch the sides because it can be uncomfortable, and there's no different here. Whenever I'm performing a procedure very deep in the ear, just want to avoid contact with the bony part of the ear canal. Sometimes we do actually make contact with the eardrum, we kiss the surface, which is actually less uncomfortable for the patient, believe it or not. It's when we touch the bony part of the ear canal that they really feel it. And that's because this bone, the inner 2/3, is just bone with a very, very thin layer of skin attached. The thickness of that skin is 0.1 millimeters in thickness. So there's no buffering, there's no fatty tissue, there's no cartilage there. It's just literally skin on bone. So we're in the anterior recess, and you can just see the amazing view that we can achieve with the iClearScope wireless endoscope. I'm able to really gain access in this anterior recess. Now, what's interesting with this patient, their hammer bone, so their malleus, it's kind of protruding out of the eardrum slightly, so possibly a bit of an anterior retraction of the eardrum. And what that's caused is on the parallel to the bone, you can see there's a ridge of wax that's kind of embedded perpendicular to this piece of bone. So it's difficult to remove that because I don't want to make contact with the hammer bone with the suction probe. So I'm having to just always ensure any wax residual wax I'm removing, I'm not making contact with the bone. You can see in the anterior posterior quadrant, so that's the medical term, but in layman terms, the top left of the eardrum, where I'm going now, we've got the short process of the hammer bone, so there's a protrusion of the hammer bone that we all have, but that's quite prominent, and the eardrum has enveloped itself, it's wrapped itself over that short process and sunken in a bit. We call that a retraction pocket. And the patient has got a bit of soft wax, a bit of keratin in that retraction pocket. Now, I'm hoping that will now naturally migrate because the impaction in front of it has been removed. It's not possible. I did make a couple of attempts, but the suction probe is too wide. It's not in that space where the eardrum has wrapped itself around that short process of the hammer bone when it's retracted and sunken in, where we've got that bit of cartilage and keratin. I'm not able to access it with the suction probe. It's too wide, and the fine end is really narrow anyway. So any residual wax you saw on that eardrum will naturally migrate. Patient's feeling $1 million. And yeah, well, I hope you're all keeping well and safe wherever you are in the world watching this, and in the UK with the sun's out. So I'm going to put my shades on, some sun cream, and get a tan. Take care, bye. Oh, a quick PS. Some people might question why we didn't irrigate to wash the rest of that piece of wax out. Irrigation in the UK is, wherever possible, we try and avoid, because water in the ear has got inherent risks. To learn more about that, I uploaded a radio interview I did with Mr Keith Vaz on Leica Radio, so feel free to follow that link. It's on my playlist, it's on my videos on my channel, and you'll learn more why myself in particular are trying to avoid using water to, yeah, take care, bye.